It's like if somebody was like, bungee jump off this bridge, there's a 54% chance you'll be fine. Like, no.
Help me with hip-hop. Let's get it right. Protect your patience. Day and night. Donna and David, the experts on your side. Help me with hip-hop. Let's get it right.
All right, in this episode, we're going to be talking about being busy, being broke, being breached.
Among other things.
Or maybe we should say pick any two. I don't know. I mean, I'll pick busy and broke. I don't want to be breached, but
I know. Got
some stuff today for sure, man. OCR has 2 settlements that have come out recently since our last talk about them. They seem to be throwing them rapid fire here lately.
Yeah, they've done 4 in April.
I know. It's just crazy. Mm-hmm. So we'll look at those real quickly, and then we're going to dive into some reports, some DBERS, data breach investigations reports. There's 2 of them. One is by M-Trends. We'll take a little bit of a look at that one. And then we have the Verizon 2025 DBIR, which we cover every year for as long as I can remember.
I count on that report for many things. So
yep. So it's always good, and it's always fun to read because whoever puts it out has the kind of sense of humor that we like.
Yes, we do.
We'll cover that and quote some of the funny things that's in that report. Although the findings themselves aren't funny, it is nice to see that we're not the only ones that have a sense of humor about bad things.
Yeah. Yeah. Even though some people have said, you shouldn't snicker and giggle about such a serious topic. Well, you try doing the serious topic all day, every day.
Yeah, that's true.
Yeah.
That is very true. All right, let's dive into some settlements. So let's cover the first one. So the first one came out, I think, like middle of last week. So
the 23rd.
Yep. 5 days ago or so as we're recording. And this one's a bigger settlement. So the big sexy numbers, $600,000 in a 2-year corrective action plan.
Yeah. So imagine what that would have been if it weren't for the 2-year corrective action plan.
Ooh, yeah.
I mean, who knows what it could have been. But it is a large organization, and the name has been torture for us.
Yeah, so it's PIH Health. And so as we're talking about this, we'll be talking about PIH having PHI.
Mm-hmm. So that's going to get screwed up right away.
It's going to butcher, we'll butcher that, but you know what we mean. How about
that? Let's get our quote in there real quick, David.
All right, so the acting director, Anthony Archevil, says hacking is one of the most common types of large breaches reported to OCR every year. HIPAA-regulated entities need to be proactive and remedy the deficiencies in their HIPAA compliance programs before these deficiencies result in the impermissible disclosure of patients' PHI.
Yeah. So it was a large breach, you say? And so they 5 different violations on their list, which when we go through the next one, you'll see why that's kind of like, okay. So here you've got a really large organization, and so much so that it was 189,763 individuals that were breached. That PIH reported that the EPHI was disclosed of for the many. But here's why I think that they really got hit so hard is in January 2020.
Okay.
They report that a phishing attack compromised 40 5 employee accounts. And all those patients were involved in all of those accounts. And it happened between June 11th and June 21st, 2019.
That's a bit beyond 60 days.
Yeah, they must have misread it and thought 6 months.
I guess that even then they missed it.
You know.
So now you probably don't know the answer to this, but if we're talking about 45 breached email accounts, and then we're talking about patient records, are we saying that all those records were tied up in email accounts?
That has been my experience. I've had to, be a breach coach multiple times. This is why I am absolutely against, we use encrypted email. That's really the least of my concern.
But Donna, all the PHI is in the cloud, EMR and EHR. It is not in their email accounts.
That's right. Yeah. It's nowhere else. Yeah, I know.
Yeah. I just had this question the other week. I had to write a whole white paper on it because it upset me so bad. But this physical therapy office, so small, right? Physical therapy office. All of our data is in our cloud EHR. Do we need any of the security stuff, really?
I know.
I'm like, I'm going to send you 508 episodes to listen to. Just,
somewhere in there, maybe you'll figure out what I'm talking about. Right?
Yeah. And, I'm sure the look on my face was more like waiting for the punchline. Like, you're joking, right? Like, are we still having this conversation?
That's where you look
security?
behind you and go, you talking to me?
Yeah. Are you serious? Really? I thought we, myth busted that one a long time ago, but apparently not.
No. And in fact, we'll touch on that some in these reports that we're talking about. So, failure to use or disclose protected health information only as permitted or required. So, boom, that's obvious once you have a breach and that happened. Failure to conduct an accurate and thorough risk analysis of the potential risk and vulnerabilities to the CIA of EPHI held by PIH. I got it.
Good job.
That was focused. Failure to notify affected individuals of the breach within 60 days. Failure to notify HHS within 60 days. Failure to notify the media within 60 days. So a lot of people don't realize that breach notification thing, if you're not hitting that 60 days on a major breach, anything over 500 or more, guess what? That's 3 violations.
Yeah.
3 separate ones. So that's $600,000 and a 2-year corrective action plan, which, says you're going to do all of those things and have a breach notification policy, which is why you have one, so on and so forth. So,
but just to make it clear, though, let's tell folks that you don't have 60 days.
No.
Specifically.
No. It should be as soon as possible, but no later than 60 days. It doesn't mean 60 days. And in fact, if if you have an account, and let's say one of those 45 accounts is an employee who's been there, 20, I've had this happen. Employee's been there 20 years, had the same email account, and let's say they always worked in patient scheduling, different levels, different jobs within that realm and billing. Well, they're loaded. Unless you're purging that puppy, it's loaded up. And, you could have 3,000 in a single one, let's say. Well, I immediately know, if based on who that employee is, I know I'm going to have a breach that's greater than, 499. I already know that.
Sure. Yeah.
I don't know how many, but I know it. So you know what I'm going to do? I'm going to go ahead and report a data breach. You know, pick a number, put 400 on there because I don't know what it is. And I don't want to like make it look like it was only 500 when it hits the, you know, if I say it's 500, it goes out there and then I make it a lot more, then it looks bad in other ways. So if I say 400, it doesn't hit the big breach, you know, list. And I've notified HHS. And I'm telling them at that time, you know, here's what's happened. And you know what? They're going to work with you.
Mm-hmm.
But I don't know what all happened up in here. But something didn't go well.
Yeah.
But that June 11th to June 21st, that 10-day thing, remember that. We're going to come back to that.
All right. And not to leave out you small folks, OCR had another settlement that came out Friday, I don't know, whatever date that was, Friday, 25th.
25th.
Yeah, the 25th, it came out. And this one is their 12th ransomware enforcement action, 8th of the risk analysis initiative. This one is a small practice. Very small. So for all you folks, you know, won't happen to me. I'm too small. Nobody wants what I have. OCR's not paying attention, all this kind of stuff. This was a small neurology practice up in Hollis, New York, called Comprehensive Neurology. Single physician, one physician, and 5 full-time staff.
Should have been a dermatologist.
So the doctor's name is Dr. Zitzer, and Donna says he should have been a derm. But
yeah.
So not very good for Dr. Zitzer. He got hit with $25,000 in a 2-year corrective action plan, and we'll go over a little bit about what happened. This one also in 2020, OCR was notified by Comprehensive that in December. This is interesting because on December 14th, they became aware that they had issues because it was a ransomware attack. Pretty easy to figure out, right? Now, the cool thing was, according to what I'm looking at, they notified OCR like in 3 days.
Yeah, that's what this is telling us. December 14th is when they couldn't access medical records. And their internal investigation determined that they had been hit with ransomware. 6,800 individuals may have been affected by the breach. They notified HHS on December 17th, exactly like I just said. They did the right thing at that point. Mm-hmm. However, their only violation that they got dinged with was failure to do an SRA.
Yeah.
The cap has some things in it that makes you think they found other things, but they only dinged them with that violation. Had they done the SRA, they probably would have been just fine. Mm-hmm. And they probably thought they did an SRA, because this is a problem that we have all the time. They think they know what they're supposed to do, and they think they've done it. But they do not know what they're supposed to do. So, you know, I think I know how to pull teeth. Just get some pliers, but I don't do it.
String in a doorknob, that'll do it every time.
Yeah, I always pulled all my own. I was afraid of them doing that doorknob thing with me. But they still $25,000 fine and a 2-year corrective action plan. Mm-hmm. So, you know, but they just didn't have it. So go ahead and hit the quote here. And we do know that it's probably not Zitzer and Arch Evil, but we ain't got no sense anyway. So just before you correct us, we know we're probably wrong. In fact, I know we are on Arch Evil, but I can't remember what they told me on how to pronounce it. So I got nothing.
All right. So this time, Director Anthony says, Effective cybersecurity requires proactively implementing the HIPAA security rule requirements before a breach or cybersecurity incident occurs. That'd be nice. OCR urges healthcare entities to prioritize compliance with the HIPAA security rule risk analysis requirement.
Yes, which is what we've tried to tell people to do.
Yeah.
So, their CAP has them doing a risk analysis, implementing a risk management plan, and reviewing their written policies and procedures and training its workforce on its HIPAA policies and procedures. See,
right.
that's an important point.
Yeah.
I made them read it when they got hired 9 years ago. Okay. Yeah, I trained them.
Yeah. Trained them on the templates I bought before I filled them in.
Yeah. They know enter name here said you better do this. All right. All right, let's do busy, broken, breached.
All right, let's get it.
So 2 different reports, and they came out kind of really close together. And they both basically give us the same information. And I like to mention the M-Trends one, although the Verizon one, I use it for reference the entire year. I get a new one. I start updating stuff. I'm using it all the time. And I always give them credit because I really like their report. But basically, we did an episode not too long ago that healthcare has a kick me sign.
Yeah.
Well, these reports say it's got a hack me sign. And we care about your privacy webpage. That's probably what the hackers know how to find you. The more you say that on there. But here are that will not protect you. To simply say that you have done all these things and you do all these things and you've got certifications and you can say you've done high trust and you can say all of these things, it's not going to make a difference as far as the hackers are concerned. They're still going to look and see, that we can probably get in anyway, they say.
Yeah. And in fact, I would say that hackers might look at that and go, let's just see how good you are.
Yeah. That's what I'm always worried about. I'm just paranoid about, them stumbling on us and doing that. So if it does happen, you'll know. If you're targeted, I'm sorry, but if they are targeting you, it's going to be hard today.
Yeah.
For you to not give up something. If they have actively decided, oh, you going down, then that's going to be hard. So anyway, the Mandiant Consulting does this M-Trends report, and they do it based on their consulting investigation. So their actual incident response projects that they do throughout the year. And they said that this report included 450,000 hours of investigations into incidents. And that's just them, and you know how many companies do this. They're one of the biggest names in doing it, granted, but there are tons of companies that do this work. So
that feels like about how many hours I put in a week.
No, that's what it feels like. 450,000 hours. They did learn a few things, but stolen credentials, 16% of the investigation. So that's second most in their experience. Second most reason for initial infection. And it's a significant increase because of these info stealers that they're seeing.
Yeah. This is a little interesting in that there are people that talk about dark web scans. And, dark web scans, if you don't know, it's going out looking to see if your information is out there on the dark web. Most of us know that our information is out there to some extent. What we don't know sometimes is, do they have our latest passwords? The ones I just changed. And so these dark web scans help with that. There's actually, a number of people inside and outside of IT that think that dark web scans are a complete waste of time, waste of money. This would prove that maybe they need to rethink that, because if stolen credentials are now the second most common initial infection vector, it might be a good idea to understand what stolen credentials are out there so you can make sure you take action on that.
I know, right? If you don't, if you've never even looked, and if there are people who it doesn't resonate with them, they're like, oh, it doesn't matter. I've been breached. I don't have to worry about anything, right?
Yeah.
It doesn't resonate with them what's out there. And when you give them that list, it does have a way of getting people to go, oh, wait, click.
Yeah.
That just went into place. So according to Mandiant, I'm probably butchering that too. Exploits were their top infection vector. 33% of the cases they worked, then stolen credentials, and then phishing. So exploits, those are your things that you're supposed to fix, by patching.
Mm-hmm.
But they can use email phishing and social engineering to take advantage of an exploit. So just keep that in mind. But here's where we want to talk about the 10 days. The global median dwell time. So how long they're in there. So they get in, they hang around. How long before they're there?
Mm-hmm.
It's up to 11 days. Last year it was 10 days. Guess what? 10 days they were in, the 45 employees, 10 days. Dwell time is 26 days when external entities are the ones that are notifying the victim. So they're finding that activity. They've been in there. 5 days when the criminals notify the victim, which is, generally your ransomware. So back in the day that most people understand ransomware, they would drop it off, run it, boom, you're dead, right? You're just like, poof, your systems are going down. They didn't hang around in there. They weren't doing anything but getting you to run a program somehow that would encrypt everything.
Mm-hmm.
That's not how they're doing it now. So they're in there roaming around. So if there's no exfiltration of the data, but they're roaming around looking at the data, you still have an unauthorized access.
Yep.
So just note to self, I'm just going to say. And organizations that catch it themselves, it usually takes about 10 days. So it's very interesting. Of all the incidents they worked on, ransomware, 21% of all of them. Financially motivated threat actors made up 55% of the threat groups. So, no doubt about it. They're after money. They got the info stealer malware, cloud compromise risk, and unsecured data repositories are big problems. So,
yeah.
compromised cloud configurations. Access to data in the cloud does not mean you don't need all this security, David.
Nope, it does not. Well, the other piece that people often miss is that these cloud vendors will say your data can be stored in a HIPAA compliant manner. Our platform can be used in a HIPAA compliant manner. However, it is up to you to configure it in such a way that makes it secure.
And for you to use it in such a way that makes it secure.
Yeah. And you can't just outsource all that.
No.
And that's one of the things I hear often. Like, again, we got our data in the cloud. Why do we need to? Well, is anybody making sure it's configured properly? Anybody looking at it? Are you doing your assessments and looking over those things? Even if you set it right when it first initially got set up, doesn't mean it's still set up right.
Yes, you are correct. Because it changes. I don't know if you know this, but it changes all the time.
Yeah.
They also pointed out the North Korean IT workers are set up as it's like they're really posing as, employees in a lot of cases. We reviewed one that, somebody caught them right there at the beginning, but they had gone through the vetting process. So this is a big issue, and I've seen it popping up in discussions a lot more frequently.
Mm-hmm.
And then I thought this was interesting. Centralized authority. So everybody's into, well, I'm gonna handle everything with the Azure logins, and we're gonna have single sign-on. You log into that, and it logs into everything else. Same, you can use Azure, you can use Google Workspace, you can use Jump Cloud. There's a ton of different ways that you can do this, right? So why, if you think that I log into that thing and now I can get to everything, why do you think that the criminals wouldn't go after that thing?
Oh yeah. Yeah. I mean, I mentioned this, I don't know, this is a long time back. We had this conversation and I was like, not really liking the whole single sign-on thing. If it's not well protected, it just gives people even more access.
And so I worry about, I'm small enough, but I would really start to be concerned. And, Okta got hit a couple of years ago. They were one of the big names in it, still are. But they're clearly going after all of these. So just keep in mind that also is a target that they're after. Just because you're doing it doesn't mean they're not after it.
Yep.
And then as far as healthcare, they pointed out it's a top target that they are seeing as well. Ransomware, cloud compromises, and credential theft, particularly high. And healthcare incidents tied to financially motivated groups. But they said they also saw espionage-focused campaigns going after sensitive healthcare data. And I haven't done I couldn't really find in there that they really went into that anywhere. So I'm going to have to look and see if I can find it. But nonetheless, I'm a fan of it. And so that's a lot for the Mandiant one, right? And so now let's go to Verizon, because it is
All
fun.
right.
This is the 16th year of the M trends and the 15th year of the Verizon one. So they've got data out the wazoo.
Oh yeah.
They know, and that's why we read them, because they know what they're looking at. But they also have developed methods for taking massive amounts of information and making it usable. So, and that's before AI. So they take all that, fold it into AI. It's going to be interesting to see what they get. But this is just an example, like right at the beginning, and it's all throughout the document. But that humor and wit in the writing, you really should read it.
Yeah.
This is just one example. Grace us with your physical eyeballs and human cognition perfected over thousands of years of evolution. We promise it will be worth it. and that's just like one. There's some others down in there. But they evaluated 22,052 real-world security incidents in 139 countries.
Wow.
Of those, 12,195 were confirmed data breaches. But they say this is the most data they have ever covered in a single report. So they've been doing it all this time. And, as they said, it's our 15th anniversary.
Yeah.
But they also made a point here that I thought was super interesting right before we get into the data. And it was twofold. Although the threat landscape can vary somewhat due to organizational size, mission, and location, there are always certain overarching themes that seem to predominate our data set regardless of any of these variables. This year is no exception. And then here's the kicker. Possibly the most obvious and noteworthy among them is the role that third-party relationships play in how and why breaches occur. And we've already gathered up some stuff we're probably going to discuss next week, if not next week, the week after, because there's some other stuff happening. I just realized, but we'll figure it out. We got that new report coming out from HSCC. I think it comes out like tomorrow. I don't know, soon. And we're going to go over that, but we'll figure that one out. So, but it's the third party stuff. I mean, they're full of third party discussions in this Verizon report, and Mandiant brought it up several times in theirs. It's a big deal. And the other thing they made a distinction about, they explained all of their terms at the beginning so you can follow along. And, you know, they basically start with, they even said, if this is your first time reading, you should start here. But this is something that we come across a lot, and I find that I have to explain this a lot. And they do make the difference between incident and breach.
Yeah.
And this is the same thing, is all breaches are incidents, but not all incidents are breaches.
Mm-hmm.
It's like, I always equate it to all bourbons are whiskey, but not all whiskeys are bourbons. Say that
That's
all.
one way to look at it.
Yeah.
Yeah.
It's the same thing. If you understand one, you'll understand the other. Everything is a security incident if you think something has happened. Even if you think it's happened and you're tracking it, you have an incident, right? And the question is, does that incident rise to the level of a breach when data is compromised in some way?
Yeah. So if I'm knocking at your network door, that's an incident.
Mm-hmm.
If I'm trying to find a way in, that's an incident. Doesn't mean I breached it.
Well, and even if you
incident.
did manage to get in, but you never were able to get to any of the data.
Right.
But once you could get into the network, but the minute you can touch the data, you can get into a device that has data on it. Doesn't matter what it is. Or you're parked somewhere reading the data. That if I don't have secure transmissions, and this another thing drives me nuts. Oh, I don't have to worry about securing that because it's, you know, behind, it's our local network. You must assume they're in. So anyway, there are two different things. So when something's happening, don't say we have a breach. You don't say we have a breach till we know we've actually had a compromise of data that rises to the level of a breach. Then you can say it's a breach. But prior to that, you say there's an incident. We are monitoring an incident. We are investigating an incident, whatever. But once you know data is compromised, now we're talking about an incident that involves a breach.
Right. Yeah. You don't go around telling people that you got an infection. You just tell them that you got an itch.
Exactly. Something's itching. I don't know what. And you know, there you go. So that's a very important distinction that so many people miss. And I really wanted to bring that up again because they do a really good job of dividing those two discussions out and saying, you know, 22,000 incidents, 12,000 breaches. But they have a lot of charts and graphs and all that kind of stuff. And this one that shows the ransomware, it's a trend of the percentage of ransomware over time from 2020 to 2025. And I don't know, it looks like somebody made a really cool roller coaster.
That's always going up.
That's always going up. It goes up a little, you know, slight, and then goes up really steep, and then levels out a little bit and dips and takes off. And we have not seen the top of it. But it's substantial. I mean, you're talking about in 2020 when we were really, at that point, really starting to see them. And that's where they were really starting to make the money on them. They had switched to businesses. That switch took a while, but then they had gotten good at it. So at that time, their report, they had less than 10% of their total incidents involve ransomware. It's, I don't know, 45%, 44% is ransomware. That is a 37% increase from last year.
Not slowing down.
No, and that's what we've got to get people to understand. I mean, it's not. As far as their viewpoint, though, credential abuse is the most common access vector, with vulnerabilities is second, but it's up a substantial amount. Vulnerabilities are. So slightly different, just a little bit of a switch there between what Mandiant's involved in and what they're seeing, and then this review of all these incidents. So it does show you from a big picture perspective, though, the vulnerabilities have gotten a lot worse. That's what Mandiant's seeing is bringing them in now. And the number two thing is, stolen credentials, credential abuse. And those are still the top two things that they're seeing. It's just what order with, how they're getting in. The good news is 64% of the victims of the ransomware attacks refuse to pay. That's up substantially.
It is.
And the median ransom amount has dropped because people aren't paying.
Right.
It's down to $115,000. That's the median, not the average.
Right.
So that's the middle number. And that's still more money than you and I ever want to. I don't want to give them any money.
I won't pay them $115, much less $115.
I know, right? But here's the one that was really bad. And this is busy, broken, breached. All the small business. So we already talked about, I'm too small. And they got a ransomware attack. And that was in that settlement we just discussed. Well, this data that they've evaluated, small business, 88% of their breaches are ransomware attacks.
Ooh, 88.
Yes. That's just crazy.
If only there was like a easy framework that addressed ransomware.
Yeah. I mean, if you do most of these things, top 5 threats, number
just
one.
Give me like 10 things to do. What's like 10 things I could do?
Ransomware, it's in the top 5 threats, and it's not going away. It might be moving up. But I mean, and there's some more numbers we're going to look at on small business in just a minute. But third-party involvement in breaches. So, the screaming hot potato that's flying through at us, coming at us just as insane, doubled from 15% to 30%.
Ooh.
Doubled in a year. That's crazy. And then, of course, you got your the espionage. They bring it up too. So I really am going to have to understand what the espionage is all about that they're seeing. But generally they're coming in with a vulnerability. So there's an exploit with espionage as the motive. And then, of course, generative AI. AI was in there.
Yeah.
You know it.
Mm-hmm.
Use of AI in malicious emails doubled. 15% of employees are accessing generative AI services at work, sometimes unsafely.
Yep. Shadow AI.
Shadow AI. It's there, folks. We're seeing it everywhere. So it's being used improperly internally. It's being used by the bad guys. If you're not getting your hands around it, it's already out of control.
Mm-hmm.
So don't wait. We said this a year ago, though. I don't know. If you listened then, good for you. So here's the other thing. That at first you read it and you think, that's great. 54% of perimeter vulnerability. So that means the things that face the public internet. 54% fully remediated in the past year.
Huh. Okay.
Sounds great.
In a year? Right.
Yeah. But how many then does it mean didn't get remediated in the past year?
Almost the same amount.
So now it doesn't sound great. 46% did not get remediated. That does not sound as exciting.
Mm-mm.
So that's how they're getting in.
It's like if somebody was like, bungee jump off this bridge, there's a 54% chance you'll be fine. Like, no.
Bad guys are coming after you. You got a 54% chance they won't catch you.
Yeah.
Those are
That's
not your
good.
odds. But give us an example, David, of a perimeter vulnerability that a small business might have sitting there that they have no idea is there.
Oh, well, usually it's the firewall or lack thereof
Yeah.
that's sitting there. More times than not, even if they have a decent firewall, if I say something like, well, when's the last time it was updated? They're like, what? Updated? There is none. Or they'll have one. I had this conversation last week. Somebody had a Sonic wall. And I was like, well, when's the last time that you renewed your subscription on it? And they were like, subscription? I was like, yeah. And they were like, no, we just bought it. And I'm like, oh, well, we need to look into that because it may be they're allowing traffic through, but it may not actually have any security features functioning because you don't have an active subscription on it.
Yeah. So that's let's say, you've got a firewall, but if no one's checking it and making sure the software on that firewall is up to date and no one's making sure that all the security features are being used properly and that nothing's getting turned off, you got a perimeter vulnerability. Yeah.
And that's one of the cases with firewalls, which is most people are like, well, the internet works, so I'm good.
Yeah.
I'm like, no, that's not what we're trying to accomplish here. We want the internet to work, but we want the security pieces to work. That's what we're trying to accomplish.
Yeah. So that, if you look at on most of these ransomware attacks, they're in there messing around, let's say 5 days. They can do a lot of damage in 5 days. A lot can happen
in 5 minutes.
5 days. And they can suck out all kinds of information, review things, and convert things to text and download and make them really fast. I mean, there's so much. And it's huge to have somebody, even 5 days, roaming around. If you have those kind of perimeter vulnerabilities, that's how they get in. There's some easy way that allows them to bypass whatever security you think is there. They can just go around it.
Yep.
So, anyway.
This is why there's the multiple layers of defense and defense in depth and all that.
Yep.
It's the easiest way to think about it is, you've got a big fence, and then you got a moat, and then you got, castle walls, and then inside that, it's like all these different layers and layers and layers before they get to the gold.
Right.
Which is your data. And that's the same thing.
You don't have, when you get behind, if they got past the fence and then they got past the moat and then they got over the castle wall, you don't have everybody just standing there going, here's your gold, you made it.
No.
They would still have people to fight and, in that scenario. So anyway, it's a huge
Release
thing.
the Kraken.
And so Verizon always breaks things down into healthcare specific. They do several different industries. So if you have other industries you're interested in, go check it out. The healthcare ones, of course, is we're going to focus on. And as they stated, it's still a prime target. 1,710 incidents, 1,542 confirmed breaches.
That's like what, 80 something, 90 something percent?
It's insane, yeah.
So almost all incidents turned into breaches.
But not all incidents are breaches.
No.
But all the breaches.
Not, except for healthcare. In this report. I mean, I don't know what the percentage is right off the top of my head, but that's crazy.
Well,
most of them are breaches.
And a few years ago, they had a statement that I used for a long time in my presentations that healthcare had the distinction of being the only industry where insider issues were bigger problems than hackers.
Yeah.
And, whether it be mistakes, errors, or malicious insiders, that was, a bigger problem. Congratulations, healthcare. We no longer have to say that.
This year.
Yeah, it is ransomware system intrusion of some sort, including ransomware. Now the leading cause. It's no longer errors. Great news. But they bring up espionage motives in healthcare increased to 16%. They bring it up too. So, in healthcare specifically. Third-party breaches are a huge issue.
Yes, indeed.
And you've got your pharma firms, your IT providers. I mean, all kinds of folks are getting hit. And they recognize two things: that healthcare has some reporting requirements. So there could be other people having data breaches that are not reporting. Not, they're not telling us. But in healthcare, I would guess, based on what we know of the 1,710 incidents, some of those probably should have been reported as data breaches. But, I'm not going to say that. I'm guessing. I'm not saying it's for sure, but educated guess. But the ransomware reason is they know we are supposed to be saving lives, providing care. And, whether it's cancer treatments or a crying baby that is seriously sick, you need to do it now. And you don't have time to switch over to the manual process. We just go to paper. I encourage people who believe their disaster plan is, we'll just go to paper. Have a week that you set aside and you plan to go to paper. You know what?
Yeah,
you should probably start with just an afternoon.
Do it for an hour.
Yeah. Because it's a lot more than you would think.
Yeah.
And so I also pulled the chart that I thought was really interesting. The top patterns over time in healthcare breaches and miscellaneous errors just spiked in 2024. It took a little dip in 2023 and then spiked in 2024. But they're tracking privilege misuse, miscellaneous errors, system intrusion, and then everything else. And everything else shot way up.
Oh, yeah. I mean, it was almost nothing all the way back to 2019.
Yeah, it just kind of a little bump along, and then all of a sudden, it is straight up. And
yeah, it's almost the number one. It's right there at it.
Yeah. And system intrusion is, just slightly above it. Good to see that privilege misuse has dropped significantly, and hope that it's gotten this low before, but it didn't stay there. So we hope that it'll stay there. And I think there's enough things being put in place that's trying to help that, but it's still a problem.
Yeah. Well, I think this kind of shows that people, the criminals and others are changing their tactics, because now everything else, whatever that entails, is such a big deal, whereas it wasn't before, which tells me that the miscellaneous area system intrusion and privilege misuse are no longer the things to worry most about.
Right. And they have this all broken down into web stuff. It's broken down into a lot of things. And a big area is web application intrusion. So just keep that in mind, folks. Web application, cloud, security. Cloud. But they also break it down. Occasionally they'll do the small business thing, and they've done it. I don't think they did it last year, but they've done it. And they first looked at it back in 2013, and they saw there was a distinct difference between the number of attacks after large business versus small business. Back then, in the before times, olden days, they weren't getting the money. Small businesses weren't as connected as they are today. There's a lot of things that are different. And a big part of that, they point out as the opening to this session, this was another one of their pithy statements. This year, we decided to take another look and see how things currently stand. Let's jump into the results. But before we do, spoiler alert, it's mostly bad news for small and medium businesses. Yeah.
It is.
It is mostly bad news. Too bad our bad, but it's, it's not good. So they looked at, and they just broke it down. More than 1,000, less than 1,000. That's it. That's it. Make it easy in a very basic way so you can do at a glance. And there's really not a lot of differences. Not, I mean, the espionage is 3%, ideology is 1% of the motives on the large businesses, where they're not really registering an entire percentage. In the small business, financial is the number one. It's the motive all the time. They want to get your money. And as far as the top patterns, system intrusion, social engineering, basic web application attacks. On the large, that's the small. On the large, system intrusion, basic web application attacks, and miscellaneous errors. So, however you look at it, it's just the layers are slightly, they've got a lot more depth in the layers, but the volume of the ones they looked at, 3,049 incidents with 2,842 confirmed data disclosures in small businesses where they compared them. On the large, 982 incidents with 751 confirmed disclosures.
Yeah. So if you're small, you're much more likely to get hit.
Yeah, there are a lot more cases. So we're bringing it back to where we started. We know that when you're a small entity, you say, I'm too busy. I don't have time. I don't have enough money. Well, you're going to be busy, broke, and breached.
There you go. Oh, man. Terrible.
Yeah, I know. We make
All
bad
right,
jokes.
folks. We do. That is our show for today. Go out there, make yourself not busy, not broke, and not breached. And until next time, remember that HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.